Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
This place right now. Believe it. Believe it. Believe it. Believe it. Okay. Hello and welcome to another edition of Health Matters. Wherever you are tonight, we are discussing customer service and ethics in healthcare. And as we going to be looking at Liberia as a case study tonight. And with us tonight, we have Kekula Tokpa. He is the Secretary General of the National Health Workers Union of Liberia. And so, Kekula, I want to say welcome to Health Matters.
Thank you, Pastor Ato. I'm grateful to be a part of this platform.
Thank you so much for accepting our invitation. We know there have been a lot of stories about, customer service as, customer service and ethics in the health field in Liberia. And so tonight we're going to be diving into that. Wherever you are, I want you to please do me a favor, share the video, share the broadcast, and our numbers is on screen. It's you can call us on WhatsApp. It's 952-201-9287 to join the discussion. You can also text your questions and you can make your comments. When we have the time, we will respond to them, accordingly. We also want to say welcome to Quina Cooper.
Sorry, I'm so sorry.
She is joining us, and she's also a healthcare worker here. Family nurse practitioner, and she's going to form part of this discussion. So we are glad to have you. Quina, you are welcome.
I'm so sorry.
That's okay.
I'm sorry for coming late, but
we are glad that you are here.
Okay.
Yeah, that's the main thing. And tonight promised to be another wonderful, a beautiful night, interesting discussion. Healthcare workers of Liberia. We're going to be diving, we're going to be dissecting them tonight. I know there are some out there that, this message will not come, it will not settle down well with them. But nevertheless, we believe there are good people in a healthy in Liberia. There are some wonderful, wonderful nurses and doctors and health workers in that place. At the same time, there are some very, very bad apples that are spoiling the name of those people. And so tonight we are bringing awareness and education. So if you are in a healthcare field, it is because you love it. Not because of the money, it's because you have decided you want to dedicate your service to humanity. And so whatever you do, do it with all your heart. And so I want to give the opportunity to my platform guests. Quina is a regular contributor to this program, so she's not a guest. But Kekula is our guest. Kekula is our guest.
Hello, sir. How are you?
So we're gonna give.
I'm good. I'm good, Quina. I'm okay. Thank you.
Seconds, just give your opening statement, and then we move on. We'll start with Kekula because he's joining us for the first time. Kekula.
Yeah, I'm grateful for the invitation. As we've come to discuss customer service and ethics, my hope is that we will listen up, we will speak up what are those things that affect customer service, and we'll look at ethics or it's just meant so that we can all look at the flaws or the negatives in the field and then to see how we can find a way to move it forward. Again, I'm very grateful for the invitation. I am the Secretary General for the Bomi chapter of the National Health Workers Union of Liberia. I am a nurse working for the government of Liberia and the people of Liberia. I'm so grateful for the invitation. Thank you very much.
Thank you so much. We are glad you accepted our invitation. It's an honor, to have you with us this evening. Quina, you want to say something?
Well, I'm just happy that we can come here and dialogue, Lord, put heads together, come up with ideas and suggestions, because Liberia is our country. As we say, Liberia would be the only country that would not deport you. So we champion Liberia, we pray for Liberia, we want the best for Liberia because God knows that's where our neighbor's dreams bury, and that's where we want to be. So whatever contribution we can make, we welcome to do it with our brothers and sisters with open arms.
Thank you so much. Just before you came on, I was telling Kekula that God has a reason for planting us over there. I mean, it is not by mistake that we were born in Liberia. So, whatever little contribution we can make, I mean, we just have to make that. So, I'm glad that we have the same mind. And, the word of God says, if these people, if they are of the same mind, and if they are of the same mind, they can do great things. They can do wonderful things. He saw them building the Tower of Babel. And when he saw them, he said, wow. I mean, he I want to say he marveled at the whole thing, but that's what unity does. It brings you to the place of fulfillment. So I'm glad that we are in one accord. Having said that, we are talking about customer service tonight. We are not saying that there are all bad people in the field in Liberia, but at the same time, people need to be reminded of their obligations, their responsibility towards the patient, the clients, the people they care for, the people they took ought to care for. And we want to know, what is customer service? That's the first thing we want to talk about first. The question, Kekula, we come to you. You're the first person here. What is customer service in healthcare?
Thank you very much, Pastor Eto. Let's look at two words. There are just two words:
Okay.
customer and service. Now, if we look at customers, customer is Quina, who is going to the market, maybe Douala market or Pizza market, to buy something or to buy boni to go and cook. That market woman who is selling the boni is the service provider. Whatever is going to be done between them, giving her service, giving her the fish, and she paying her money to give her the fish, that is the service. So in healthcare, the patients or the clients are our customers. And the service, what we do for the patients are the service. And the service provider is that healthcare practitioner who is either sitting down at the hospital, sitting down at the clinic, or sitting down in the community providing some health messages, giving some health awareness. So customer service is just someone is giving a service, someone is telling you is doing something for you, and you are the receiver. So you're the one receiving. Customers, you who receiving the service. The service is that action, that thing that is being done. For instance, if they were to provide health messages to you, that is a service they are provided. So customer, the one who is buying or receiving the health messages, and those health messages are the service that are being provided.
Thank you so much. Thank you so much. I want to come to Quina. You want to throw light on, I mean, he said it the way
Hmm.
it's supposed to be,
Yeah,
but we have variation. Maybe you have something you want to add to that question.
I mean, he sold it perfectly, and the in the hospital now we call them the clients. They are our clients. We render, like you said, we render service to our clients, and if we don't have them, we will have no business. So we are the providers. We are, the people providing service for our clients. So we have to treat them with respect and dignity. Because if they don't come, there would be no business for us. There will be nobody for us to treat. So we have to treat them with respect and dignity because we want them to come back to our business. We want them to go out and tell people what service we render to them, take our good name. Because bad news travel faster than good news. So if you don't treat your client right, you will have bad reviews on everything. So our clients, we have to treat them with respect, we have to treat them with dignity, and we want them to come back. So we have to treat them, our customer, our client, the right way. So we rendered service today. Yeah, we can hear you.
So true. We have to treat them with respect. We have to treat them with dignity. I want to know, why is it important in healthcare? We have gotten the definition, what customer service look like, what it is. But why is it very, very important in healthcare? Kekula.
Okay, okay. You see, now the customers that we are serving, that customer is that person who will come at your health facility. He comes, he show up either at your counseling center, he show up either at your post, your health post. Is that person who has the condition, who has the problem, he's showing up at that facility so that he got some needs, there are some issues, there are some problem he has, and he or she wants the problem resolved. So that customer is that person who has a problem. He wants you to meet those needs. He wants those needs, those conditions, those problems he has, he wants those problems met. He wants the problem resolved. So it's that customer who is showing up. Now to answer the question, let's look at a customer who has come, those things that those customer that has come to you in the morning. So what they will require of you is that they will require some attitudes from you, as Queen rightly said, because you have to put up an attitude that is going to help that clients to always come back. So the importance of customer service, one, in the healthcare system, is because if somebody came down with malaria, the reasons why they are coming to you at their health facility is because they want to get cured. They want their malaria to go away. So for you as a person to provide then the cure, the services, it means that for me, the first thing you need to be trained. You have to be a practitioner who know exactly how to treat malaria. If you are not trained as a health practitioner, either as a nurse, a physician assistant, a doctor, or the community health assistant, you will not be able to provide the services for that malaria condition to go away. So the first motivating you is to be trained, because when you are trained, you are going to be able to give the right kind of treatment. When the right kind of treatment is being given to that sick person, it will reduce burden on the family. Because if you don't treat that person, what happens if you don't get treated and they die? It means that you have destroyed that family. Maybe that person was the one who was bringing services, who were delivering, who were looking for food, fetching for food and everything for the family. So the importance of customer service is for us to keep hanging in there so that they can be served, so the community can be better, so the community can get improved, so that all of the issues, so that they will not be there and getting sick, nobody is serving them. So customer service is very important because it will reduce of disease burden, and it's going to make the clients in the community to build up more confidence and interest in the healthcare delivery system. They will put trust, they're going to put confidence and say, yes, we're confident that the health system is working. So the important, yes, the health system will be provided, the health services will be provided in such a condition. It actually helps to reduce the burden on the family, and it also helps to keep the morale of the health system, and then to keep the citizens moving.
Mhm.
Thank you so much. Queen
Yeah.
I.
Yeah, customer service is very important in healthcare because one, the credibility of the hospital, your institution is, is important. So it's within healthcare, it's competition. Clients go to hospital, they want the best. So you're competing for cares for these patients. You're competing for clients to come back. So you have to treat them right. You have surveys that you give people. You always want to be number 10. So you're always trying to improve things in your hospital. giving them the right care, evidence-based practice, treating them right, um, like the disease process, as he said. So you want people to come back. You want to treat them, give them the right diagnosis, treat them the right way. For people to go and say that hospital has a good credibility. I went to that hospital. I got good treatment. They treated me in the right way. They gave me the right medicine, and I was able to get killed. And I came home. Then they would tell other people about you, and you would come. They would come in too. So why don't they want to go to Catholic or JFK? They want to go to Catholic Hospital because they have better experience at Catholic Hospital. They went there, they were treated with respect. They took them in, they treated them, gave them the right medicine, follow up, told them to come back for it, for evaluation and all of that. But when they went to another hospital, they didn't get that same care. So they have continuity of care at that hospital. The credibility of that hospital, was high enough for them. They gave them a survey and they were satisfied with the care that they gave. So that's why it's so important. Satisfaction, were all their needs met. They had a favorable outcome with their situation. That's why it's so important.
Thank you, Queen. I want to ask Kekula. There are a lot of bad report about customer service in Liberia, especially with healthcare workers. I know it's in other industry, but our concentration here today is healthcare. You know, are they aware of the ethics in healthcare?
Yeah. Everyone in the health system should be aware of ethics. And that's why, again, one reason could be that they are aware. So, one thing that will keep them being fully aware continuously is to conduct regular in service training to remind them. Yes, in every bag of a bag of apple, there will be some very bad apples, as you rightly said. But again, over the time, we need to conduct refresher training every now and then, remind the healthcare providers that look, this is what you need to do. Like we're talking about customer service, because customer service will boost. It's not only going to bring back, it's not only going to make the health facility, the health worker feeling happy, but it's also going to boost the morale of the community or the entire
Yeah.
Ministry of Health, for instance, in Liberia. If customer came here, Queen and said in the health facility and they got treated well, there are more clients are going to come back, more patients are going to come back because they trust this system. It's not only giving them drugs, it's also keeping their secret. We call it keeping their secret, keeping
Privacy.
their
Yeah.
records secret, being careful with their records because you will not have one patient record that is just scattered all over the place. They will not want to come
Mhm.
back to you. And then our approach, yes, there are some bad apples among the apples that are in the bag. But again, there are also some very good ones there. And then over time, when we conduct the refreshers training, doing a reminder, maybe we also need to in the country, we need to also take them there so that they can learn from the school. And then when they come back here, when they come to work, and they can also be showed up. Yes, indeed. We need to work over time on it. There are some bad apples, but it's far better. There are a lot of them are also better. A lot of them are also better. A lot of healthcare providers are doing very well. Those few ones that are not very good, we will keep working with them and then providing training, talking to them. I mean, putting them down on the side and telling them, "Look, let's have some discussion." I'm also providing continuous supportive supervision. That continuous supportive supervision is when you go and meet the person on the job and you are not policing them, but you are also giving them new ideas. You are telling them, no, this way, can we do it this way? Yeah, you did this and we didn't get a good result. Can we do it this way? So with that, they can help us over time to get over that. They can get us to correct that bad customer service yet. But a lot of it is better in Liberia. There are a lot of good things that are coming. Our customer service here at sometimes it's some bad with some healthcare providers. But most of us, it's okay. We can work with that. Again, I can say we can train them over and over. We can get some good results.
Mhm.
I want to ask. Let me come back to you, Kekula. Quina, just
Yeah.
1 minute. Um, there's this adage that goes like, when you go to Rome, You do as the Romans.
Mhm.
When you go to room, do as the Roman. So I, I'm asking this question because the level at which our customer service has been elevated in the healthcare system. Does this mean that, you know, they went to Rome and they saw the Romans the way they were behaving, so they started behaving like the Romans? Like if you went, it's a culture. It has become a culture since I'm in this facility, and it that usually happen when you in a place and you get there, and the culture that is established there, you
Mhm.
just roll into it and you start doing the same thing. Is this the
Yeah.
case that is affecting healthcare in Liberia?
Well, culture
No,
too.
this
I
is
think.
no.
Oh,
What?
go ahead. Sorry. I'm
But,
saying
but
from my
Quina, 1 minute,
my
yeah,
oh, Decula is for
yeah,
me.
that Kekula, because he's
Oh,
he's
Decula,
gonna
go
be
ahead.
ahead. Yeah.
Okay.
Decula, go ahead.
Now, no, it's not. No, it's not, Pastor. Because again, what I said is that if you got a child in the house and Pastor Ato leave in the morning, she goes to work. She come back maybe at 10 p.m. The kids are already asleep. She doesn't know what's going on. She's not monitoring what are the children school, what are their clothes are washed clean, what were the children food, how was the food the children ate at home today. So that's what again I said, we need to go back to continuous regular supportive supervision, because with a continual regular supportive supervision, the staff will know that they will be reminded that this is wrong. Even if somebody left and went to a room and want to behave like the Romans, they will know that here is not a place that they behave like a Roman. You have to change here. If they came here, they say that our supervisor is going to come back tomorrow to require of us the result of what happened. They will come and question us. What wrong with this neonatal death that had taken place here? What happened here? What was the responsibility? What caused this? So if you have someone asking us, we have the Ministry of Health making sure that regular supervision are conducted all over these facilities in a given area at a given time. You see that these things will move downward. But again, because sometimes people are left without being supervised, and again, some people have their own way of doing things. Just and then also they come from whom with different reasons, and people got different reasons of coming into a profession. That one reason, people got different reasons for coming to the profession. You said it earlier on. There are people who are coming because they think that the medical field is where they will get rich. And this happened with doctors, they will happen with nurses, they will happen with physician assistants, and all other healthcare providers. So with that notion in mind, I need to ride the car. But again, over time is actually better. It has not gotten worse in Liberia. It's actually over time. Supervision training will help us to eradicate or reduce the number of bad customer service that will be in the profession, that will be in the health sector.
Quina, you want to throw a light on that, though you're not in Liberia?
Well, I'm not in Liberia, but I have family members that have experienced,
Hmm.
situation like that. And healthcare is very stressful, right?
It is.
Um, from when I was a nurse here in the States, I don't know the patient ratio, the nurses carry in Liberia.
Wait, let's hold it right there. Let's ask Kekula, is there a patient ratio? Like doctor to patient, is there a ratio that is established?
For nurses and patients.
Yeah.
There's a ratio. But again, we look at it when you come like to the outpatient department, because the government doesn't have money to employ the number of persons, the number of nurses or physicians or healthcare provider at the time. So sometimes you got less number. You got a nurse who will be taking care of maybe 10, 15, 20 patients. I don't know actually what the ratio should be. So if you got a nurse who is taking care of more than 25 patients, that also the burden that could also be responsible for poor customer service. I mean, that should never happen. There should never be such ad. That person should be able to receive those services or care that is required. They should come back and get better and go back home. They should not come back and treat it as if they are nothing. They are nothing. No, they are. They need to be served. So when they need to be served, why they need to be served? So again, we can look at the ratio. We can look at the number of patients, the number of the patient to a nurse or the doctor or the physician assistant. Sometimes the number is huge. Sometimes you got a physician assistant or a healthcare or a screener who is doing more, who is seeing more patients that should be required. So that could be one other reason, but that should not be an excuse why
No,
there should be poor customer service. That should not be the reason
it
why.
shouldn't be an excuse. It shouldn't be an excuse, but that can lead to
Yeah.
that can lead to that because patients, you don't even have time to give patient good care, and you're making a lot of mistakes. You getting, and that causes a lot of burnout because when you burn out, then that causes a lot of problems. Short anger, you're not providing good care. Short tempers, very tired, very exhausted, not giving the right medication. You don't even have time to go between patients. So burnout is very bad in terms of safety, in terms of customer service, in terms of even improving the quality of healthcare for the patients. And then another thing, when it comes to customer service, again, I think my suggestion is, or what I think should be, the Ministry of Health should make it mandatory. Like,
Training.
yeah, it's mandatory that we go to, um, customer service classes or ethic classes, and you have to sign those paper yearly. You go to those classes, people do role playing, you watch videos, and it's things that you do yearly, part of your annual training.
Mm-hmm.
We do have annual
Necessary.
training that people have to meet every year, and that comes play into your evaluation, and it's mandatory for you to do those things before you renew your nursing license and things. Those are regular things you have to do regularly on an annual basis. So, and those papers have to be signed that you met the criteria for that, you went to the class, you did this. And also, when we have J code here, right, that accredited hospital, they come and check each person files. You have your file, and those things have to be in your file, and you do it on your anniversary date from the time you are hired. So they check your file and make sure, and they will come randomly and pick up a file and make sure that your employees went through all those things, that you keeping track on all those things that would create safety for the hospital, bring credibility, and treat people with respect and dignity. Like you say, people records, they will not go talk about people records. Oh, yeah, we call it HIPAA, privacy
Mm-hmm.
law. And we have to sign those things. If you
Yeah.
breach the law, you will be fired. You can get sued, you can be fired. So, we sign all, people got to sign all those things, the privacy law, because the patient want to know that it's safe.
Let me
And
let
the other
me
thing,
let me interrupt you, Queena.
yes,
I know here in a healthy, everyone that work in a healthy, you have to sign that document. Do
yeah.
they have something like that in Liberia, the Privacy Act, or that you have to sign as an employee?
Yeah, when there is a privacy document that you need to sign as an employee. But now, whether everyone who is employed or working in Liberia as a nurse or doctor or a physician assistant has signed that, I can speak to that. Yeah, but you are supposed to sign those documents, even like sexual violence, sexual gender-based violence issues. You have to sign onto those documents. You have to also sign a face of signature. Yes, I will do and live by this. This is what I will do. This is what I will not do. They are available. But whether all of what I sign onto it, whether all of what I wear, whether it was brought to us to sign it, that I can speak
Mm-hmm.
to it, yes, but yet indeed I signed on such a document as a nurse back then. We have signed, we have the document. And I just wanted to say something quickly. You see, we have bodies that are responsible for regulating ethics,
Mm-hmm.
regulating healthcare professional. On the top, we have the Liberia Medical and Dental Council that say on the top. Then we got the Liberia Board for Nursing and Midwifery. They are
Mm,
responsible for making sure that we practice what we practice ethically. We are fit. They also make sure to give a license. So I also think that the board group, they also have reason. The physician system also has a board. So we also
Mm-hmm.
need to work with them. They also need to come on board regularly, as all of us are saying, so that we can provide the refreshers trainings. Because what the refreshers training will do, that it is going to remind us our healthcare providers. It's going
yes.
to tell us that, look, you are supposed to be doing this. You are missing upon something. You are missing out on the curricula. You are missing out on this. You need to do this. You need to do this. So that will help us. But we have tried now.
Okay.
The National Health Workers Union of Liberia does not have the power or the authority to checkmate someone and say this is wrong. Like there's a case at GFK. That case was reported to George. George brought it up. We took a case up. We could not follow that case up, even though we were interested in knowing what happened. We wanted to see if the nurses that were accused, we wanted to have that dating code, if it was right, if it was wrong. So we wanted them to face the full weight, whoever went wrong. We wanted to be clear. But again, the one who brought the case abandoned the case along the line, and they didn't come back to push the case forward. So again, we were left lying, sitting there. I don't know exactly what happened, what at the end. And you cannot push for a case that the one who brought a case is not following up in a court. So how will you go through the case? So we couldn't follow up, and then the health worker union abandoned that. So again, I'm saying the Ministry of Health, like you said, the Liberia Medical Dental Council, Liberia Medical Dental Association, and the Liberia Nursing Board, Liberia Board for Nursing and Midwifery, the PA Board, they all can come together so that we can have a perfect customer service. Yes, actually, at some point in time, customer service get really poor from some of our police.
We'll come back to that question on that case stuff, but we'll come back after Queen.
Okay.
Yeah, please.
But I want to say this is it's about time. This is we shouldn't have excuse for this. We have to make it right. It's been going on too long. And I really think the Ministry of Health should be an oversight regulatory body for every hospital. They should come up with a plan making sure that every hospital following the rules and regulations. Because if the hospital knows that people coming there, to check on them, making sure that things going right once or twice a year, people will start doing those things. So I think the Ministry of Health here I feel that they fall short in that area. And then the nurses and people working need to know that people care about them, right? Give them support. Like you said, you went to court and they were abandoned. The nurses go to work and they do all these very, very hard nursing job. Is very stressful. So you need to show your nurses you care. You need to show your nurses that you have the interest. Give them the environment that conducive to work. You may not have everything in Liberia, but give them some of the tools that they need. When it comes to you, they need a listening ears and somebody to be there to say, I understand, I know this, but we need to do this in this direction. And the nurses need to know too, the patients that you're taking care of. Think about that person could be your family member, your child, your mother, your daughter. And when you're not there, you want your colleagues or that nurse to take care of that person that you will be at peace. It could be your relative, and the way you want them to take care of you, that's how you should take care of them. If everybody do it that way, we would be fine.
Okay, let me go back to
Kekura. I thought Pastor, before you come in, let me make a point, please, before you come in. And you see, for us to have an effective running customer service, as Queen said, the tools the nurse need to work with, the tools need to be available. Because it's another thing here that the nurse is qualified, the nurse is trained, the nurse is polite and got a very good customer attitude, then the tools to work with are not available. Let's take for example, you come at the hospital, maybe there are no gloves. How is that nurse or that health practitioner, how will he or she, how is he going to conduct an examination? There are no examination gloves available. That will make the work very, very difficult. So again, we have tools, we have drugs and supply available. That can also help to make it very, very easy. You also need the environment. If let's say for emergency room, the emergency room should be a place where that nurse will feel comfortable. The client or the patient that is coming in that room should also feel very, very comfortable while they are having their 1, 2, 3, or 5-minute discussion. So again, we need to look, while we are looking at the service provider, we also looking at those things that are supposed to make the service provider to work, like the Ministry of Health providing all of the tools, all of the equipment that will be needed for that person to function very well, to provide better services to the customers that are coming, or the patient, the client. So we also need to consider that the government also has a bigger role to play. Besides only monitoring, besides making sure that the people are there, they should also make sure that supplies drugs and drugs are available. Imagine that in Liberia right now, Queen and Pastor, there are areas where that patient must be able to buy fuel oil for the ambulance to move into the next level. Because it is not that institution does not have the fuel. They are not being the fuel, are not being
Really
provided.
terrible.
Again, they have to
Horrible.
provide it. You have to provide it. Patients will have, and then
So if you
so
don't
the
have that
customer
money
service
to
gets very
provide,
terrible because there are no drugs.
you are
Yeah,
dead. If you don't have
as
that
some
money
health
to
facility,
provide a
not
few,
throughout the country.
I mean, I'm
How
not
would the
cutting you
ambulance
off.
move?
Yeah, it's sad. My sister died at JFK, and that hurt me. And the common thing that here is so common that my sister had, they didn't even misdiagnosing her, and then they tell her they can't get drugs until Monday. How can you do that? You dead Friday, no medication. This is a well-known hospital. My little brother just got sick the other day, and thank God he's doing better. But he went to Fidelity. They will not touch him until they pay. And I begged them, cry and beg, and they made a how you call it, payment arrangement, which they were not supposed to do. The day I was supposed to send the last payment, the girl, I made a payment arrangement, so I didn't send it that morning. They fired the girl. I'm like, I said I would send them the day, and I sent it, and I blasted them, and I begged them to get a girl her job back because I said I was going to send it after I leave work, and now I had to send money for my brother care. How many people do not have that? How many people? And it's just bad. They need to invest into the healthcare system in Liberia, patient. They need to invest in the healthcare. They need to give the nurses, the workers, supplies because it's safety
exactly.
on them too. It's their safety. They can't go work with all
The
gloves.
question, yeah, it brings me
They're
to
not
the
being
question.
protected.
Yeah,
They're not protected. You,
you
you
talk about he talk about not having gloves and all that.
yes,
The
it's
first thing
their
you are
life
talking
in
about
jeopardy.
universal safety precaution. You
Yes,
are supposed to assume that that person is infected with any, transferable
anything.
disease,
Yeah,
communicable disease,
anybody that
any kind of
Exactly.
thing.
watching you
Yeah,
in front of
Exactly.
you, you assume that anybody, no
anybody.
exception.
So the
So
first thing, your first point of protection after your hand
yeah, you
washing
need to be
is your
protected.
gloves. So how then can you treat somebody with all the gloves? In that case, what do? You
They will
just
have to
leave
buy
them.
their glove and bring it out.
Can you imagine?
They buy
You
their
need
No,
a,
drugs.
you
I
just
mean,
a,
have
a
to buy
patient.
it or
they,
the
no, they
patient.
buy their gloves from outside and bring it. As
The,
some,
Oh
the,
my
the
goodness.
patient,
Yes.
I mean, common things like gloves. That's something they can even make right in
yeah,
Liberia.
I don't have the glove. I said if it is not available, as
This is why our that things are
it is not.
happening, common things
At certain point in
happening
time,
to
we didn't
our
have it. At certain
people.
some facility they didn't have it.
Hmm.
It's sad. It's sad for the healthcare workers, and it's sad for
I mean,
the
that's what I say.
patient.
Yeah.
It's sad for
Yeah,
our people. And in order for the nurses and the doctors to render the good care, they need to be taken care of too, because they're human beings and they need to have the supply to be able to do the job. Because
Exactly.
if the person don't have the right tools, they're not going to be trying to do the job right. Like me, I'm a healthcare worker. I'm not going to do nothing without gloves. No.
No. No.
Even blood pressure taking it, I want to wear my gloves. You know what I mean?
Yeah.
Because that's what we do. That's what it does. Because you have to assume anybody that come before you
Yeah. You got
affected
to
until
assume
otherwise
they can
proven,
transfer anything.
to protect yourself.
Yeah. If you're not
The
protected,
healthcare workers don't
how can
even
you
get
help
the
somebody else?
hepatitis B vaccine, or they need to get vaccine. They need to vaccinate all the healthcare workers
It's so sad.
because they are the first line of defense for people coming into.
and
Yeah, go ahead, Kekula.
patients and Queen and one reason and the one who is providing the services, the healthcare workers, need to also be motivated. You know, as say if we have continuing education, can we also provide them scholarship where they will be able to go and advance themselves? Can we also be
Yeah.
able look at the salary they will make? Can we also the salary that is being made by health workers? It's also
Yeah.
demotivating, so it will also contribute to poor customer service. Because if I am
Exactly.
sitting
That's
here,
what I'm
patient,
saying.
Queen, tomorrow morning my child carry maybe $100 tomorrow, or he or she will not go to school,
That's
or
what I'm
I
saying.
did
You
not even
gotta
have
take
money to
care of them.
leave to my family by home. Today the second we are not getting salary. We don't know when salary coming. You don't know how your family need to have food to eat. You need to have food to eat. You also need to take care of other family members. If there are family issues, that's also a factor that will contribute to the healthcare provider providing process, because sometimes we come to work very, just down, broken down because of some family issues. So we
Stress,
also need to look
stress.
at this. The government needs to look at the care. What care? Who the health worker is? What can we do for them? What can we do to motivate them? One who is motivated will never perform poorly. But most of the time when they are motivated, we're not
Yeah.
saying that. We are not saying perform poorly because you are being demotivated. But we're saying these things need to be put in place. So what we're talking about here is the customer service need to be up. Yes, the service provider need to go up. We should also be saying that service provider also needs to be taken care of. He has
Yeah.
family. He or she has family. He needs to sleep. He needs to sleep in a good place. The working environment need to also be good.
They need to. And continue education training on the job
Yes,
and all
continuing
classes they
education. That's
need
what I
to
said.
do.
Yeah. Yeah.
Yeah.
So the facilities involved, are they private, or this thing happen like both government and private facilities?
It's more a public facility. It's more a public facilities, because the private facility will want to make sure they make their money. They are making their money. So because they don't want to lose a single patient or client, they will do their best so they will be able, so that a lot of person will go to their facility for care. So they will also be able to make money. So sometimes it's actually not good at their facility, but bulk of it will be at some of the health facilities, because no salary up to today's the second. We don't know when the last one paycheck is coming. Nobody knows yet when it will come. It's very little when it comes. Again, we're not saying perform poorly, but again, let's look at this. The people can say something like, bro, that money can make bigger to dance. You heard that before, Patience and Queen? You heard that before? That money can make bigger to dance. The
Yeah,
woman bigger. When you give the woman bigger money during the Christmas season, it will dance more. It will
yeah,
dance more. So if you take care of healthcare providers, if you just look at it, if you just pay a little bit more attention to them, if you just provide them scholarship, let them go for continuing education, let them get some more training.
Hmm.
They should also have the opportunity. They should not only be
Yes.
people up, let them also have the opportunity to sleep in better places. Let them also have
Yes.
opportunity to also have a room they will work in, where that room will be. It will be a nice place for them to also sit down and serve. They should have some places where they will be also look at them and say, this nurse is coming. They should also have transportation to come to work, not paying their own transportation to go. They should be able to provide a bus, even if you take a minimum amount from that salary. But there should be a bus that will take in, because they will be saving their own bus. But some healthcare providers are also riding on motorbikes at night, early morning hours, because they have to go to work and they have to go back home to their families. So all of these things need to be considered as we discuss customer service. But yet, customer service is very, very important. Yes, it is.
let me
But
take
everyone
some
need to play the
comments.
role they have to play to make
Yeah,
customer service very strong and working.
let me take some questions from our viewers. Some more comments and questions. The person said Liberians have an attitude of respecting people with coat suit. Is that a
Hmm.
cause for discrimination and not respecting first come first serve? All the people that are dress up or the in government
Yes,
position,
that is
or
so
in
wrong.
you dress up well, you go with the coat suit,
Yeah.
and people, they start discriminating, especially uh, uh at
Yeah.
the hospitals and stuff. So he's saying,
Yeah. I don't know. Okay, Kulai, on over here
We
where I
should
work.
not be discriminated. Yeah,
Exactly.
yeah.
I'm saying where we work here, every patient are treated equally,
Yeah.
the same. I don't care if it's the president of the United States or someone just came up the street. The same thing apply across the board. So
So why do we do that? Why people do that? Like the when you see somebody close to you come, and meanwhile people supposed to either form a queue in a hospital. They sit according to the way they come. First in, first serve, like that. And that there are some people that make appointments, right? The same thing, they're supposed to join the queue. Your appointment's supposed to be uh,
Yeah.
time. Like, this is the time you go in. This time is already set for you. At the same time, um, people are sitting in the queue and they are waiting, and that place is not emergency. Emergency, the clinics, I don't believe the clinics, they're supposed to take those emergency cases to the clinic. The clinic, they're supposed to take it to the hospital. And even at the hospital, there are people that are there that go for emergency, but because they are not dressed, or the people that took them to the hospital, they don't look like somebody with money, and so they are discriminated against. Is that that is not part of the ethics of healthcare? But why is it so rampant? Why is it so, all over the place? Why people do that? Because, go ahead, let me not jump
You, you
ahead of
see
you.
again, as a again, as I said, we need continuous reminder of healthcare workers. So because I am not supposed to take patients before Quina because I know patient. If all of them supposed to form the queue except emergency, I am not supposed to take patient before Quina because Quina is close to me. Everyone should be treated fairly. Until we try to, it's working at some point in time. We try to work with this. For instance, okay, let me come back to emergency. If there was an emergency, and then that emergency will be served before you who are in the queue, because if a child came convulsing,
Yeah.
of course we cannot leave that child convulsing. But now it should be my business to come and tell the other customer or the patient who are outside, this person is an emergency, or this person is an emergency, and we are going to take care of it and come back for you later. But again, I should not have somebody dressed up in close or my closer friends taking them from the queue when they are not emergency. At some point in time, again, they always buy apples in the bag. Over time, this is going to work. Over time, we're going to reduce this. Over time, we're going to talk to them. Again, they have to come with training. They have to come with reminders. If we got continued and regular supported supervision being carried out at the institution, the facility, especially public health facility, this will go down. But I'm not too sure. At my facility, it's not as worse as maybe people have think at other places. I've not heard about it being really worse, where you bring in 10 persons, you're leaving everybody in line, taking their own persons to come in first. But again, if that is happening, that is wrong. That should not be happening in the health system. Everyone should be treated equally.
It's more than reminder, though. It's more than reminder. It has to be some kind of policy that is
yeah,
written that people need to follow. Let me take
exactly.
one more question here. In fact, Abby is saying something like that. She's saying constant reminders.
It's called policy and
It's called
procedure.
policy and
Yeah.
procedures. So if the person know this thing is written on the books, and this is what I'm supposed to do.
And patient, not just policy and procedure, but enforcement also.
Oh
Because
yeah,
a lot of things on the books in Liberia, but it's not being enforced. It's not being put into place. So constant enforcement.
that's right. That's right. And then Abby also said that the gloves issue have been there
The
long
line is
time.
40.
That's sad. This is it's too sad. I mean, excuses can be. These are people risking their lives. So then, at some point, it needs to stop.
Yeah,
It needs to stop. Even the people that are working at the health ministry, like right now, the minister is a doctor and she work here. So they know people can't be working without gloves. And people have a knowledge of these things. So they should put it into place. It's bad.
And one of the comments, Abby says, one of the problems, the patients have no legal recourse in Liberia. Who will they sue? They can't afford to sue anyway. They can't sue anyone. Like the case you brought up, I heard Josh talk about it the last time. And once somebody file a complaint, it should be no longer the person that filed the complaint running behind the case.
Yeah.
It should be the department, it should be, let me not say department, the Ministry of Health that should take up that case and say, we have to see the end of this case and see what it is. Here, if something happened in the course of your the discharge of your duty, they suspend you. The first thing they suspend investigation open. They're not gonna be, they're not gonna call the person that reported you and say, oh, can't carry the person to court. Have you heard something like that, Quina? Or
No.
if you're not here, we're not looking into the case. No, they're looking into that case. The facilitator is involved. The person that the accused is involved. All the big names you can think about in healthcare, they are all involved. Because the next thing they're going to revoke your license. They're not even talking about the person that reported you.
No replications.
They're not talking about the person that reported you. Now, if somebody reported and said this person, let me give you an example. My niece, I think I was telling you about my niece. She went to give birth. In Liberia, our big hospital in Liberia, referral hospital, JFK.
Oh my God.
And she went to give birth to the hospital.
I think that place need to be
and the nice said, and she was shouting, doing all kind of stuff. And women, especially your first time. And the nice, I told her to call, or maybe she might call, I don't know. But the nice told her, you finished your high school? How old are you? In fact, you are nice. You're supposed to have the record, the patient record. Even though the patient, if you just coming to treat them, you ask for the name, the age, and all the kind of stuff. But that somebody coming to give birth, they already admitted everything, and you coming to help them to go through the process, and then you asking her, you finish with high school? Does that have anything to do with her delivery at that time? And the girl said, yeah, I finished with high school. Then she told her, oh, if you finish with high school, if you finish with high school, other than that, we're going to give you C-section. So these are, to suffer the person, to make them pay more money, because she said, because you're young children this time, you're going to listen to your parents. The only thing you all know how to do is to get pregnant. So, oh my goodness. It's funny, but it is serious. It is serious. So people just go around giving people operation because they want to punish them. Oh, she calling. Hello? Lofty? Yeah, let me put you on speaker. Okay, you on speaker, Sharon.
Hello.
Hi.
Hello, how are you?
I'm fine, thanks. I was just monitoring the discussion, and I just
How you doing?
My own little experience as pertaining what you guys are discussing, which is like a major issue in our country. Excuse me, guys. Just a minute. Which is like a major issue and a major crisis, I would say, in our country, because at the end of the day, if the medical system in our society is not up to standard, if you don't have trained professionals in the field, it leads to a lot of disaster, it leads to a lot of death, it leads to so many different problems, medical problems and stuff like that. So I was listening to you guys and I was like, I'm going to call and give my own experience, because until some of these things happen to you and people come up and say they are happening, you dispute the fight, you defend your people, or you defend the system. I can remember when I was pregnant with my daughter. That was in 2009. I gave birth to my daughter. I gave birth to my daughter. I went to the hospital. I was in pain for like a couple of days. And I was taking the redemption.
Oh, redemption.
When I was taking the redemption, I was like, well, I don't want to stay in the hospital. What they wanted was for me to stay in the hospital at redemption because they said it was so clean and they was taking a while for my service to open. But looking at the condition of the hospital, it was not something that I wanted to like have to deal with. Firstly, you enter the hospital, you're sick or you're already feeling uncomfortable, but the smell of the hospital is not even pleasant enough. The environment is not even clean, decent, and neat enough. You're already sick. And then you're going to the hospital and inhaling more funny scent, more, I'm sorry to say for my expression, more stink smell. You're inhaling a lot of different smell. You're looking at people in like different conditions. People are just lying down. There is just no privacy. There is just no privacy. So I was like, I cannot stay here even for a night in redemption. So when it was time for me to like give birth, my mom took me to a private clinic, a very renowned private hospital. And in the process, it took me a couple of hours. My service was not still opening. And then when it was almost time, I believe, the male worker who was working on me, who was assigned to me, she was like, how old are you? I told her I'm 25 years of age. She asked me, are you done with high school? And I said, yes. And she made a statement. She was like, God bless you. You're not one of those little girls who their mom forcing them to go to school and they don't want to go to school. They want to be doing man business. Because if you were one of those girls who never wanted to go to school and they went and got pregnant, I would have taken you upstairs to do C-section because you are too afraid. That was what I was told as a pregnant woman in pain. And when I left from the hospital, it kept playing on my mind because I have known a couple of little young girls who have gotten pregnant, go to the hospital, and the only thing you hear, oh, they gave them C-section. But that made me to come to the question here because I'm not in the medical field. That made me come to the top of thinking, after this C-section or whatever they do with women doing childbirth, after that's something they do in case they have to do it as a way of either saving the child or saving the mother or saving both parties. But unfortunately, from my experience, they were telling me if I was not done with high school, they would have taken me upstairs to do the C-section. That was what they told me. Okay. And I feel that's because we are so unprofessional in that country. The system is spoiled. The system is damaged. That's why you will have trained nurses, trained midwives, telling a young woman, telling somebody in pain that the only reason we cannot do this to you is because of this reason. That's almost like a threat already. That's like threatening somebody's life.
Okay, thank you.
You're not.
Thank you, Lofty.
Because
you don't.
Also, it's very sad that our system they need to do better. They need to do better because I also had an experience. My daughter nearly died. She was convulsing, and because they saw my sister looking a certain way, she was home cooking, and she had to rush the girl to hospital. They said they could not touch my daughter because there's a possibility my sister was going to run away and leave the child, a dying child. So, but it's really sad. It's really sad. But thank you guys for hosting me on.
Very, very sad
experience.
Thank you, Lofty. Thank you. She made it clarity it was not JFK, so we're glad we got that one settled. But there are a lot of stories that we heard. I heard some stories, so I just got it all mixed up. You want to respond to that? Should you threaten somebody with surgery in that kind of state? That's the first question. And surgery should it be based on your education? Or should it be based on the nurse moral perception of the person?
Absolutely not. And I am not too sure if any doctor, a surgeon would tell the lady in pain, it's because you have not graduated from high school, because you are this age, you didn't listen to your mom, so we are going to perform a surgery. I am not a medical doctor, but I'm sure one reason, two reasons why, one or two reasons why the medical doctor will always perform a C-section is because that lady cannot bring forth that baby by herself. So they are either trying to save the life, they are trying to save the life of the both of them, that child
That's right.
and the mother, so that the family will be happy. That is the reason why they will perform surgery, especially C-section. No one is supposed to be threatening. You are supposed to be counseled. You're supposed to be convinced. You're supposed to be told the reasons. Your family should be told the reasons why you're going to go through the surgery. Because it's a trauma. When somebody going through surgery, the family are worried. We know what's going to happen from that theater. Is our family coming back? Again, we said customer service. We're sorry when those things are happening, but we need the health worker union will let us to come back. These are feedback for us, our judging down points. They're going to help us in our own way, in our own little way, in our own little corner. We will find time to take some of the points and go back and do our own talking during our meetings, during our visitation to help facilitate to our membership. We will also take some of these things to them. Yes, indeed, whatever will happen, no one is supposed to be refused service. Nobody is supposed to undergo surgery because of your age, because you didn't listen to your mom, because you didn't graduate from high school. No surgery, no medical doctor will say that to anybody before they go to theater. No medical doctor will say that to them, even in Liberia. They won't do that.
In
And
fact, just before you come in, Queen, you're supposed to be encouraging the person. You're supposed to
yeah,
talk to them smoothly. You're supposed to make it easy for them, by your interaction, the way you talk to them. We back to customer service. But in the place where you boldly threaten, that's a threat. Queen, go ahead.
I was gonna say, yeah, that's again, you should respect every patient. You should,
Yeah.
treat everybody the same, respect everybody, regardless of the age size, and be protective of your
Yeah.
patient. One of the things you're advocate for your patient.
That's
So you
right.
should really be protective of your patients, not tearing them down. But with customer service too, another thing, they need, like I said, they need to have these sections that every healthcare provider needs to go to. Like here, from the top, the CEO or the head down to the least person, everybody go to customer service because everybody encountered,
Yeah.
patients, and customer service is everybody business
Mm-hmm.
because you make the institution as an employee.
Yeah.
So they need to come in, have sections for every employee to go
Everybody
and
that work
watch
with that
videos.
facility,
They can show
including
videos
people
from
that clean up.
different hospitals, customer service around the world. Even I saw something where Ghana have taken customer service, initiated to, and they have role plays, and they have people. Hello, my name is this. How can I help you today? And they were showing how they're treating patients. So it's something that people are trying to incorporate now into the healthcare system in Africa. So let people come to the section, watch the videos on how other hospital, how people treat other people around the world. In right
Yeah.
in some of our African countries, South Africa and stuff like that. Maybe it would help.
Yeah. Hopefully we can do some
Yeah.
kind of training as time goes by. We want to take our closing statement
Well,
before.
patient, before you close,
Yeah.
please, I have to just say one thing.
Yeah,
It
go
beyond
ahead,
my
man.
heart, Kekula, and I'm sorry, but one thing I see about our healthcare system, and I think it's probably across the board, we do not invest into our young people. People have told me how they went to the hospital, like two-person, one broke their hip,
Hmm.
and when they call for x-ray, they have the 74-year-old person, the only person in the x-ray tank. They're
Hmm.
home. They have to the wait, can't come in till after the weekend. Why do we have to have a 74-year-old person coming to do x-ray? We need to train our young people. We need to start investing into the young healthcare workers so we can pass it on. And that's the culture in Liberia. We hold on to things too long. I don't know. We're afraid for people to take things from us, but that's our
No,
generation.
that's not it. They don't have anything, no pension. So how you going to survive after you are retired?
For generation have to go forward, and we
Oh, it's breaking in. Quina is breaking in. Yeah, but most of the reason she's talking about, the youth need to be in
You
employment. Yeah,
training.
part of the
okay.
workforce instead of keeping and
Yeah.
holding on to the older generation. Oh, you want to
But I
continue,
might,
Quina?
yes, I don't think it's the younger generation not taking your job, but you preparing them so when you leave, someone will be there.
Mm-hmm.
So we need to prepare them
Yeah,
and we need to hope that they will be better than what we are because they're going to carry through. They're not kicking you out, but you want to make sure there's not a void. That's why we have
that's
so
right.
many voids right now. I sure if I'm the head of that department or if I train you, I would like for you to call me nighttime. I want to sleep at nighttime. You the nightly younger person will be able to carry on. It's not a bad thing. It's a good thing for our generation. Because at certain time when we're ready to say, I'm tired, I'm gone, then we have people to carry on.
That's right.
So I think we really need to start investing in our younger healthcare workers, younger the students, everything. They're not taking from us, but we're preparing them for to carry on when we leave.
Okay. Oh, Abby is asking a question here. Don't they have weekend staff to do X-ray like Saturday, Sunday, anything like that? Do they
Kekula
do
will
any
answer that
lab?
better.
Do they do any lab or any X-ray on those
They
days on the
do.
weekend?
Yes, for instance, here in Bomi Hill, we do not have an a functional X-ray machine, but our laboratory runs 24/7, just as all of the world will run. So other public health facilities where I've been before, where X-ray machines are functional, yes, indeed, they have the staff there. The X-ray machine they are running 24/7 for emergency. I have taken some there before at Redemption Hospital. So they are available. So the few things I just wanted to conclude, I wanted to wrap on quickly. We need
Okay.
Queen and patience. We need the political will because that political will, I mean that. Let's look at the budget of the Ministry of Health. Is that
Yeah.
budget realistic to be able to provide services for the 4 million plus people that we have in Liberia? Is that budget for the ministry is it realistic? If we are sending an ambulance in Bombay, is it possible for us? Can we put in money there to run the ambulance to provide enough fuel for that ambulance? Can we look at the service providers? Can we look at what they make? Can we look at the amount they make? Is that amount demotivating them or motivating them? Can we also look at that? Can we look at the places they sleep, the places they stay, where they work, the environment? Can we look at that? As you rightly said, training. Can we provide more training? Can we provide continual training? Can we give them an opportunity to
Yeah.
go outside of Liberia or even maybe to go to university to learn? Can we create that? Can we provide regular, we say, on-site, on-the-job training? Can we do that? Do we have supervisors? Do we have trainers who will be going and looking at them and saying, this is what we need to do? We need to also look at that. And we also talk to the customers. We also need to talk to the customers. They also need to understand that the healthcare providers, they are also human beings just as they are. Again, we are not giving excuse for any bad customer service. Customer service will be supposed to be always there and perfect. But again, we also need to make that service provider, they need to be qualified. We need to make sure that they are happy, they are motivated. We also need to they got the tools and equipment to work with. So can we now the political will? If the political will is not there, if politicians don't put out the political will by putting enough budget into the health system, we will come here and see this over and over. We can't come in the hospital, there are no drugs and medical supply. How do you expect that customer to provide? What service are they going to provide? Yeah, also we tell the service provider also, you should also, you as a service provider, put your feet in that person's shoes and say, hey, imagine if I was the one. Imagine if our patient who came with a child, that child is convulsing and behaving like this. And I told some friends, imagine if somebody came at your facility, nobody there. So what will happen if you show up or your relatives show up at another facility and there was nobody to care for you? That's gonna help us, that's gonna hurt you badly. But again, we need to look with both sides. We need to talk to both sides. The service provider need to all they have a major role to play. The guys up there also need to look at it. Government need to have the political will. The regulatory bodies, the PA board, the nursing board, LMTC, LMTA, the Ministry of Health, all of us need to come together to see what we will do, how we can correct it. Because if it is getting worse, they're not going to be there. There's no need to have a health system. But if we have a health system, yes, we need to support it. I can assure you, I can say bold on the platform, there are a lot of qualified, trained, hardworking, dedicated, and committed health practitioners
That's
in
so
this
true.
country. We just need to do a little bit more, touch them a little bit more, and then remind them.
Okay.
That's
What somebody is saying, the Minister of Health has her own functioning, fully equipped clinic.
that's true.
She knows that,
Two patient, not
these
one
things.
but two. Two.
Okay. Well, this is what one of our contributors is saying. But the government facilities, they are not fully functional and they are not fully equipped. This is really, really something I mean government need to look into. Maybe,
They
you
need to
know,
stop electing those
maybe
kind of
when
leaders.
you there shouldn't be the conflict of interest with
Yes.
people that are at the helm of the affairs of the ministry, you know, because she got her clinic and then she's a even if she had her clinic before she became minister, people will always feel that it's the ministry, whatever it is that is providing, that's where she's taking whatever from. So, to avoid all these things, I think government need to look at some of those things, not to have conflict of interest. So hopefully, things can happen for the best, Liberia. You want to get your closing remark, Aquina, before we go?
Oh. We just hope and pray, that the government can invest into healthcare and that the Ministry of Health will set a standard for healthcare in Liberia. Most time, people go to pharmacists and they just give them drugs because the pharmacist really shouldn't be the one to diagnose anybody. So people seems to just give them anything. Like my niece went to the hospital pharmacy, they just gave her some medication and they claimed that she had this. I said, how did pharmacists know you had this? The pharmacist shouldn't diagnose you. The pharmacist gave you know about the medication, but they don't know what your diagnosis is.
I
So
know.
the Ministry of Health need to set standard for healthcare in Liberia. They need to invest in the
Queen, there are
hospital. They need
standards.
to invest. Hmm? They need to invest into our
Yeah, what I
healthcare.
was saying, Queen, yeah. I
Yeah,
was
go
saying there are
ahead.
standards. All they need to do is to follow those standards. I said
Yeah,
the
the
Ministry of
application.
Health, the pharmacy board, we have standards. They just need to apply those standards, those rules. They just need to be applied. The application is
And
what
that is
making
across the board.
it terrible.
That across
So
the
it's like
board
it's
in
not
Liberia,
existing.
everything on the board for the
Yeah,
don't
yeah, that was
implement
it.
it does not
Yeah,
enforce. So the Ministry of Health needs to have
yeah,
the
yes,
regulation enforced
yeah,
into healthcare. If you can't send an inspector to the healthcare system once or twice a year, people will be on a guide to do things. They also need to invest into the healthcare workers. So in turns, they can provide good healthcare to these patients. They need to do every
yeah,
year, Kekula, once
Okay.
a year. You have to come
yeah,
demonstrate your training. If
Yeah.
they have, yeah, we have annual training and they set
Hmm.
up all the
yeah,
things that you do. And you have to come demonstrate those things to prove that you know how to do it right. And you
Okay.
even though you're doing it every day, but you have to do it in front of people.
Yeah.
So they need to have all those done. And they
Okay.
need, so
That's
we
right.
pray. We really
That's right.
do pray.
Yeah.
Customer service is and like you say, ongoing training. I'm sure people have the good heart to help, but
Mm.
we need to make more effort. Ministry
Okay.
of Health needs to do that, and
Thank you
all the
so
people
much,
in
Tina.
healthcare needs to do that.
Thank you. Zuba says if something is not done in order to help the health sector, very soon we will have death center, the health center. He said instead of health center, it's going to be death
We hope
center
not.
because people are going to die like
We
I
hope.
don't know what. But
We
I
pray
want to
not.
believe there are some
We
statistics that
really
we
Yeah.
pray
hear
not.
about the death rate and all those stuff. We not maybe the next time we come here, we want to know, uh, you know,
And
how many person dying on a daily basis at the different hospitals.
and people, I'm sorry, but people are afraid to go to the hospital because some people don't know if they're gonna make it.
Yeah,
And it shouldn't be like that.
yeah. But anyway, we is there anything you want to say, Kekula? We are closing now. That's the last you know, because I
Again, on behalf of the National Health Workers Union of Liberia, we want to thank you for this platform, for this opportunity. Again, our appeal is that we will appeal to you as we've been having discussion to
mhm.
help provide training, customer service, and other area for healthcare providers in Liberia. This is key because the product is very key. And again, I will say overtime training, overtime reminders will help our health workers who have forgotten to be reminded so that we can keep up again. We're very grateful. Thank you so much for the platform. And we hope that we all will be available whenever you want us to come back. Just let us know. We will come back again. Thank you so much.
Okay.
Thank you, Queen.
Thank you so much. Thank
Thank
you,
you. Can I get
Kekula.
your number from patient?
Yeah,
Okay.
I'll give it. Yeah. Thank you so much. Thank
Yeah,
you so much. Hopefully,
yeah,
hopefully we can work out something, some kind of. I can get my people,
yeah,
together. We can all see how best we can provide that training, including Queen and the rest of the team on health matters. See how we can provide some customer service and some other
okay,
training. I'm going to get back, like we're discussing initially, and we will conclude on that discussion.
yeah,
So, to our viewers out there, we want
okay,
to say thank you for watching us. It has been
Thank
a
you so much.
wonderful interaction here this evening concerning the health sector in Liberia. And we have as our special guest Kekula Tokpa, who is the Secretary General of the National Health Workers Union of Liberia. So, and also our own healthcare contributor on health matters here, Quina Cooper. And hopefully, we're going to be back here next Thursday to bring you another edition of Health Matters. I want to say your health matters. And those that are sick this evening, as the word of God says in 3 John 2, beloved, I wish above all things that thou mayest prosper and be in health, even as a soul prosper. May the
Amen.
Lord bring total healing to your spirit, soul, and body in the name of Jesus.
Amen.
Whatever
amen,
area you need healing, maybe in your marriage,
amen,
in your family,
Mm-hmm.
in your home, in your business, in your
Mm.
body, let the healing power of God locate you in the name
Yeah.
of Jesus. So God
Amen.
bless you. We will be here next Thursday on Health Matters. And I say
amen.
your health matters.
Amen. Amen.